My name is Dr. Sharon Byrne. I'm a nurse practitioner at the Cancer Screening Project at MD Anderson Cancer Center at Cooper, which is located in Camden, New Jersey. And specifically, I work in what is called the Cancer Outreach Project. So what I spoke about today at Congress was a project that I've been involved in for the last 10 years. It is going out into the community and doing education, and then also working with my outreach worker or lay navigator to bring in a subset of women from the South Asian population, specifically the Asian Indian population. And they come in for a dedicated cancer screening clinic that is run by both myself as the provider and my Asian Indio outreach worker, Yogini Patel. And we hold this once a month at the Cancer Center. And as I said, it's a dedicated clinic specific to that population where, depending on their presentation, their age, their risk factors, following the American Cancer Society and the New Jersey Cancer Education and Early Detection Program guidelines, we give them screening. So we screen for breast, cervical, and colorectal cancers. So what I talked about was lessons learned from that, also some barriers and facilitators related to the clinic, which has been in existence for 10 years. And I also shared some very preliminary data of a retrospective review, chart review that's going on now, that out of my panel of 437 women, we've been able to actually diagnose 14 cancers, which is pretty alarming for that small population. 7 were breast cancers, ranging from DCIS and LCIS to stage 2 breast cancers. 2 were endometrial cancers, and the others were cervical cancers. And I guess the major lessons learned was that this population definitely likes a dedicated clinic. They come as a group. They stay and support each other through the screening, go down to mammography with each other, and then leave with each other. Transportation is an issue for many of them because they don't drive, so it's one designated driver that will, drive to the clinic, or we can provide transportation back and forth. One of the other facilitators for that clinic is the actual outreach worker, who is from the same ethnic background. She serves as the lead interpreter for the clinic, so she's in the actual clinic area when I'm doing my exams and is able to interpret for me. The other facilitator is showing cultural humility, understanding their health beliefs, understanding that they don't really access the Western healthcare system, they don't really have a primary care provider, and working with them to address issues, health issues and wellness issues outside of cancer screening. The barriers have been the establishment of trust, and that was kind of early on. So when we first started the program, we had to go out to their community, to the temples, to their community center, and provide some education and screening there. When we first started bringing them into our clinics, we would get maybe 3 to 5 women that would come in. That's it. Now we basically once a month have a full day of clinic, and most of those women, I would say probably 75 to about 78% continue to come for services on a yearly basis.